Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. J. Calvert. I am here with my most studious and well-studied, well-versed co-host, Dr. Millicent Rovelo, to talk to you today. Dr. Rovelo, how are you?
I'm doing well. How are you?
You were in intense studification on the way over here to this podcast studio.
I like to be prepared. I like to know that I am well-versed and I am well-researched before I just say things. So, yes, I was studious.
You didn't even want to watch the airplane clip of the guy of them driving to the airport and hitting the guy on the bicycle.
Yeah, I'm glad I never knew you in medical school because you were like the worst study buddy. You'd be like, hey, watch this spoof. Hey, watch this clip. Hey, you want to watch a hockey game? No. I want to read my articles.
Which then brought up the group therapy scene from Austin Powers with Scott and Dr. Evil, which is one of my favorites.
This is literally how my study session was going.
It's not distracting. You should be able to study and laugh at the same time.
Well,
we were studying because we're talking about something really cool.
We are talking about brandy new implants that have just hit the market. Doctor, will you do
us
the honors? Before you do it, let me tell you what they are called.
Okay.
These are Motiva implants.
Oh,
they're so pretty.
So the reason that we're talking about them, and we are not being paid by Motiva.
Absolutely not.
God forbid.
We would welcome
we'll take it. If they want to call up and say, we'll sponsor your podcast, we're right here, people.
But alas, we are doing this promo for free.
Well, because it's interesting to our patients, and
yes,
we have a lot to say about Motiva implants.
Yes. So a little background into implants that are currently on the market in the United States. We have really, up till now, 3 major implant companies. Actually, only 3 implant companies. They are Allergan, Mentor, and Sientra. Sientra is the newest player on the market heretofore. Allergan and Mentor have been around for some time. And all of these implants we've sort of discussed and talked about before. And so I'm not going to go into necessarily the properties of those implants. Suffice to say, that's what historically has been on the market and is still on the market. Motivas are new to the market in the U.S. In the U.S. They just received their FDA clearance last month. But they have been in use in Europe for over 14, 15 years. So they are not a new product, and we'll go into what that means in terms of data and stuff like that.
I think they've been in use, not just in Europe, but like I know in Asia, Africa,
they have clearance in 85 countries.
Yeah, so they're really reliable and known devices.
Right. So if you're thinking like, ooh, I don't want to get a new device because maybe we don't have any data on how do they do long term, we actually do, and we'll go over what that is. Right.
And when we were in Dubai doing surgery, this was an implant that we could use, and I put a bunch of these into patients in the United Arab Emirates. So I probably put in about 15 pairs of Motiva implants in my patients, and they're very happy with them.
Oh, I know. I wanted a pair of Motivas put in myself, but I thought it'd be best to wait until they were actually cleared in the United States.
What year was that? Was that in...
That was 18. I think it was...
Yeah, 2018.
2018. Yeah.
So, yeah, and the reason that that wouldn't really work if we did it in Dubai is that when you come back here, you have no device support for
no device support. There's no warranty that would have applied to me.
Right.
So let's talk about what makes these Motivas different than anything else on the market so far. And a lot of it's very technical, and we don't need to get into the full technicalities of it. But one thing that's important to know is the surface technology of these implants.
Yeah.
So historically, implants, we're talking here about silicone implants. Silicone implants have a silicone inside. They're made of silicone gel on the inside, and they also have a silicone shell on the outside. That shell can either be smooth, which is, as it sounds, it's a smooth shell, or it can be textured, which means it kind of has a Velcro-y surface to it. In the past, textured devices have sort of received a bad rap because they have a higher incidence of...
I think with good reason.
With good reason.
And these are not textured, so that's an important thing to know.
Yes, but historically textured implants have a higher rate of what's called ALCL. It's a type of breast implant-associated lymphoma that has only ever been seen in textured devices across all device manufacturers. But there is one company, Allergan, which had a higher incidence of ALCL, which caused their devices, their textured devices, to actually be pulled from the market by the FDA. And so that sort of set the stage for why a lot of people, plastic surgeons, just kind of stopped using textured implants in general. Now, all implant companies up till now have had instances of the ALCL, but to a much, much less degree.
With textured implants.
With textured implants. Smooth implants have never seen any association.
Right, and it's my belief that whatever the chemical or whatever way that they created the texturing is what was causing this, lymphoma to occur. Right. So it's the process of how they did the texturing that was problematic. In my mind.
But it's also, yes, but also it has to do with the degree of texturing. So texturing can be 0, which is a smooth implant. It can be sort of a micro texture, or it can be macro textured. And the Allergan ones were macro textured. That means that if you're getting really scientific with it, electron microscopes and stuff, it has 85 microns. That's their texture surface roughness. Whereas Sientra has 40 microns, and then smooth is 0. What's interesting about these Motivas is they're about 4. So they are not quite smooth, but they're definitely not even in the micro-textured category.
Right.
But 4 seems to be very biocompatible with the texturing of the body. So smooth is actually less than what the body's actual texturing is. So 4 seems to be very biocompatible with the body. And what that means is that the body is less likely to think of that implant as foreign. And you can think of something like ALCL as almost an extreme effect of a sort of immune response. So there are other things like capsular contracture, which is also considered an immune response. And maybe ALCL is just a very extreme version of that. It's the body kind of reacting to having an implant in place. And so the less reaction you have, theoretically, the less chance you have of having complications.
Well, but that isn't even in the discussion with Motivas.
So that's the great thing about the Motivas. And so this is what they wanted to put out there. So the FDA required that they have, data and safety data before they would approve them. So we'll talk about their 14-year data that they have in other countries. But in the United States, they have 4-year data, which show that with this 4-micron texturing, they call it smooth silk. That's their terminology. They use smooth silk surfacing. They have 0 incidences of ALCL,
right?
But their capsular contracture rate is less than 1%. And that data is actually still present even in their 14-year studies, less than 1%. Their rupture rate is also less than 1%. These are crazy numbers.
Yeah.
Historically, when we were looking at 10-year data for implants, other devices have capsular contracture rates that range from about 7 to 20%, and rupture rates that are from also about 7 to 25%.
That seems so high.
That is so high. Now, granted, the U.S. data is only 4 years. Maybe if we look at that data in 10 years, we'll see a little bit higher incidences of rupture and capsular contracture. But if you look at their 14-year data, it's very similar to their 4 years. So it may not change that much.
Well, and it has a lot to do with the way that these implants are made and what they're made of. So this is kind of new in terms of the gel that is, in the implant, and then also the shell. These are very different materials than what's been available in the U.S. And this is why when I got to Dubai and I got to put these in, I was like, done. When are these getting to the U.S.? That's all I could ask. When do we get these? When do we get these? They're amazing.
Yeah, no, they kind of changed the rule book on in terms of how they made them, not only in terms of how they textured the surface, but also just how they actually make them and the gel to shell interface. All of that is just completely different technology than what's been out there before. And I think a lot of that is what contributes to their low incidence of capsular contracture and implant rupture. And they have all the warranties similar to the other companies that stands behind this kind of data.
Well, they have a good warranty that you get if you get these implants, but then they have another deal where you pay $250 and the patient does this on their own, like before, or I think even after they get the implants, they can pay the $250, and it's kind of like a lifetime warranty at that point.
Right. Plus, you get extra.
So that's good.
Yeah, their warranty is very compatible to all the other implants out there. Plus, I think maybe a little bit of extra reimbursement if you get that $250 add-on.
And the thing is that if you have these implants and you have that warranty, like you're pretty much taking care of yourself from the capsular contracture standpoint. And by the way, it's a low incidence of capsular contracture, like really low.
Really low.
And that's why, for me, I'm totally excited about them. Now, of course, in my practice, I don't do a whole lot of primary breast augmentation. If I do 6 or 7 a year, it's like a good year for primary breast augmentation. But I do a ton of remove and replace, exchange of implants, breast disasters. Yes. That's my go-to. That's what I'm doing for the weekend is, something that is a totally impossible case. And so I, of course, ask the question, but what about in people who've already had capsular contractures? Do the Motivas bring some level of relief for those patients to have an even lower level of re-encapsulation, or is it just like any other implant? You have to kind of say, like, you've already had capsular contracture, chances are you're going to get another one.
Well, that data, I think, is a little unclear because in their cohort of revision breast implant patients, their capsular contracture rate is almost 7%. It's between 6 and 7%, which is definitely higher than less than 1%. But they note that all of those patients that had capsular contracture, 5 out of 6 of them already came with a diagnosis of capsular contracture and or implant rupture. And they weren't allowed to do the special techniques that we typically do with capsular contracture, such as using ADM, Stratus, Alloderm, things like that. Other devices, other techniques that we historically use in capsular contracture cases to reduce the chances of recurrent capsular contracture. In the study, they weren't allowed to do those extra techniques, and these are patients that already had capsular contracture. And we know that the highest likelihood of patients having capsular contracture, again, the highest risk factor is a history of capsular contracture.
It is, and it's really tough, because when you tell your patient, look, you've had a capsule before, we're going to do all these things, and you can still encapsulate, it's very discouraging. And I don't know, I have patients right now who are probably going to listen to this podcast and be like, so should we do it or not? And, should we switch to Motivas and try that out? I think the answer is yes, because it's a new world with these implants. And I don't know, I have one patient I'm thinking of in particular right now who came to me with a capsular contracture, switched it out, did Stratus, all that stuff, got re-encapsulation, then said, well, let's try it without it, got another encapsulation. We did a neo subpectoral pocket, the whole thing, still encapsulated. And so now we're sitting there with a Baker 3, and that's the scale of capsular contracture. Just for the audience, for those of you playing at home, there's the Baker scale. It's Baker 1, 2, 3, or 4, and Baker 1 is a normal breast implant that's soft and pliable and wonderful, and everybody loves it. And Baker 2 is it's a little bit firm, but not really a big deal. Baker 3 is it's a visible capsular contracture, and Baker 4 is it's a visible capsular contracture and it's painful. Yeah. I think that's still the scale.
Yeah,
sometimes they change these things on me.
The scale. And so when we're talking about our capsular contracture
they changed the
rates,
TOSA scale on me a few years back, and I got a little bit miffed.
Yeah, I know. The older plastic surgeons use these weird TOSA scales that I've never heard of, and then they look at me like I'm the idiot, and I'm like, "What is grade 3 or grade 4? They threw in grade 4." And I was
we did. We had a grade 4.
I was like, "What is grade 4?" And he was like, "What do you mean what grade 4 is?" I'm like, "I've never learned grade 4."
That idiot that you're referring to is me. So and the older plastic surgeon. Right here, dude. But that's the thing. So the Baker scale is important to know. So if you have a capsular contracture and you're listening to this, that's the scale you want to kind of think about. And Baker 3 and Baker 4 are when you start thinking, I got to reoperate.
And those are the capsular contractures they're looking at in these studies, the grade 3 and grade 4.
Right. And then, of course, just for completeness, and I don't know what it was. One of the social media things said about one of my podcast clips, like, oh, you should be talking about risks of surgery in your clips. And I'm like, we talk about risks of surgery literally all the time. Like literally all the time. It's like, that is the topic of this podcast if you really break it down. So I was kind of like, did you listen to this before you sent this, like we're flagging your clip email to me? It's like, no, like we do talk about the risks, and that's like capsular contracture is one of the big risks of having breast implants. It's probably the number one issue that comes up that causes reoperation, wouldn't you say?
Oh, yeah, for sure.
Yeah, I mean, too big, too small, like I don't like the positioning, malposition, all those things can occur as well. Infections are rare, they do happen, and when they do, it's a disaster. But the reality is the thing you're going to be dealing with, if anything, is capsular contracture, which is why an implant that presents the kind of capsular contracture rate, like, run, don't walk, people. If you want breast implants, the Motivas are the ones that I would recommend in terms of capsular contracture rate. Now, they don't have every size available yet. There's a lot of, if you want 800s, Motiva doesn't have them yet. They haven't been approved by the FDA at that size. Because I know everybody wants 800s. No,
if you want 800s,
that's a joke, people.
You're going to have to go with another brand. Sorry.
Yeah, that's right. And I'll be happy to put them in. But
wait, so what are you going to tell your patient? That's how you started this whole thing with the recurrent capsular contracture.
Oh, I'm going to tell her to get the Motivas. Okay. Yeah, I think she should do it. I think that I would try it. I would try it with, either a Stratus or some sort of ADM. Again, no financial interest. Like just for disclosures, when people say like, oh, who are you consulting for? I consult for Cynosure lasers, Alma lasers, and MTF. So I don't have any breast implant consulting or anything like that. So these are just my opinions. You can take them or leave them.
I have none yet. Please.
I'd like some.
I would like some. I'd love some.
Right? Wouldn't you love some?
That'd be great.
It'd be great. Get a little endorsement, a little some sort of consulting deal. Like, why not? Right?
No, but yeah, as you said, we have no financial interest in this. Other than that, we are very interested, and I'm thrilled by this data. So I'm very excited to try them and see if they pan out. Because I hate capsular contracture, and 20% is just way too high of a capsular contracture rate for me. So I am excited to try them. So things you should know about these implants, other than their data and their safety data, they come in two different styles. So smooth silk just refers to sort of the surface of them. Right. But you can get smooth silk round or smooth silk ergonomic. And doctor, if you could lift these up for the folks at home and hold them both like this. So if you're holding these upright, you can see that this one, which is the ergonomic one, has more of a teardrop natural shape. And you can tell that the silicone is sort of less up here and more down here. Whereas on this is the round one. It sort of keeps its round shape both up top and on the bottom when held, or basically in the vertical standing position. And so the idea is that this ergonomic one behaves a little bit more and looks a little bit more natural than the round one, which has more of that augmented appearance to it. And so it's dealer choice in terms of which one you prefer and whether or not you want sort of a more natural look or a more augmented appearance. And that's the difference between the two. How it compares with actual, everyone always talks about the gummy bear implants. I think gummy bear is a term of the past, even though it's so fun to say, but nobody really uses that technology outside of the reconstruction space anymore.
Yeah, I don't like the gummy bear implants because they have problems.
They have problems. That is a 4th generation silicone implant. These are considered 6th generation implants. The ones between that obviously are the 5th generation. So gummy bear doesn't really have a place when we're talking about silicone implants anymore. Suffice to say that all of these implants have some version of a cohesive gel, and this is just the latest iteration of it.
I like them. They're good. My patients love them, and they love that the capsular contracture, rate being so low. But they really make some really nice breasts, and it's going to change the game, I think. And it gives us another option. It doesn't mean that we're not going to use Allergan or we're not going to use Mentor, we're not going to use Sientra. We're still going to use those.
There are indications for all of those.
Yes.
As you said, the size range is a little bit limited right now for the Motivas, and especially in the reconstruction space. We don't have the same range that we would otherwise use. And they're still working on some FDA clearances for implants for the reconstruction space. So there's a lot of different things that still need to be tweaked. But I think that they are an alternative for what's already out there, and I'm really looking forward to using them.
Same with me. So stay tuned, sports fans. There will be more to come on when we start putting these into patients, which I think is going to be next week.
Really soon. I have a couple already lined up. In fact, one of them came to me as I was doing her consult and was like, so I heard about these new Motiva implants. I'm like, I just opened my account.
I got them.
So
I know, we got them.
you.
We're ready.
Yeah.
So come on down. They're selling like hotcakes.
Yes.
I mean, I'm excited to try it out. And I think for my really difficult contracture patients, it's a no-brainer. We got to give it a try. Yep. And it is. It's that is a very significant part of my breast practice, is taking care of very difficult cases. That contracture is just it
sucks.
It does.
It just sucks.
It's the worst.
The worst.
I know. I just did the Girl Talk Logic podcast with Elizabeth Vargas, talking about her situation, and I think we'll get her in here as soon as we're back over at Podcast One in the studio. But her situation was dire, and would I have used these implants in her? Yeah, probably. I mean, I think the ones that we used were the best available at that time, which was a couple months ago. But now these are on the radar screen, so
we'll see.
We'll see what we got to do. All right, doctor. Well, anything else about the Motivas?
Nope, I think that's it.
Then this is the Beverly Hills Plastic Surgery Podcast, coming to you from the 90210.